Hello everyone, this is Dr. Mac again with my video number 2. As I promised everyone that I will be doing a video on infection control. So let's get into it without wasting any time. So as I said and previously mentioned in my last video, that infection control is a very major thing in Australia. So if you don't know, or if you're not clear, your concepts are still not clear about infection control, you better do that before going to the exam, because even a minor mistake in the eyes of the examiner, if that's a big mistake, they don't compromise infection control in Australia here. So even a tiny bit mistake that you may feel, it's maybe I was just a small mistake, but maybe according to the examiner it's a big mistake, they may fail you. Your whole exam just goes away from your hands straight away. So as I say, I keep telling everyone, the more you learn is less. Make sure your infection control is spot on, like there are no compromises. Even a tiny bit mistake, if you have any problems, make sure you clear your concept before you go in for your exam. It's very, very essential. So first thing, let's talk about what infection control is. Infection control is basically, it's a process of preventing infection. It's a process through which we prevent cross-contamination from one person to another. It can either be from dentist to, for example, patient. It can either be from patient to dentist. It can either be from patient to another patient, from dentist to other staff members like receptionists or dental assistants, from DA to another DA. So it can basically, cross-contamination is a big thing, and then it can basically cause from one person to another, who can be anyone, from inside the dental office, outside the dental office, from inside to inside, outside to outside. So it's all a mix of all those things. So you need to know exactly the basics of infection control. Another thing is importance of personal protective equipments, PPE, how to wear them, in what order do you wear them, in what order do you remove them, washing hands, when to wash hands, when to sanitize, and for example, if you drop an instrument, how to follow the protocol. If you want to change the settings of your loops, if you're wearing loops, you're wearing lights, on your loops, if you want to change the setting, how to do that. So we're going to discuss all that today. And as much as I can, I will just go through basic concept first. Then we'll go to the technical day, and then we'll go to the clinical day and try to make clear as much as I can, okay? So infection control methods, and at the same time, personal protective equipments. Let's talk about first is your personal protective equipments. How many, what are the types? So for your exam, you just need to worry about 4 things: gloves, masks, protective eyewear, and then you need your gown. These are the 4 things. And with the new format, what they have done is you will be wearing the gown the entire time. You will not be removing your gown. So that tells us that for your exam, you just need to worry about these 3 things. So they've made it a lot simple for you all now. So glasses, mask, gloves. We just need to worry about these things because you will be wearing the gown the entire time. You won't be removing it anymore now. Okay? Let's discuss in what order do we wear the PPE, which is again very important. A lot of confusions still. First thing, please make sure if you're wearing anything, bands, watches, rings, don't wear it. Please remove it before your exam. Again and again and again, please do not wear anything like these. Just remove it. The only reason is when we wash our hands, a lot of people wash till here, which is again wrong. You have to wash up till here. Up till here you need to come. Close, and up till here you need to wash your hands. If you wash till here, it's wrong. The examiner may say it, some examiner may not say it, but again, I tell people, do you want to risk that thing for your whole exam, costing you your whole exam? You don't want to risk it. I didn't risk it, so you shouldn't risk it as well, right? So for your exam, don't wear any rings, no watches, no bracelets, nothing, okay? Make sure your nails, they should be small. For all the girls, there should be no nail polish. Your nails can't be really long. Please don't do that. Especially for your exam, please don't do that, okay? You can do whatever you want to afterwards, after passing the exam, do whatever. after your exam, do whatever. Before your exam, do whatever. But at the same time, make sure when you're going for your exam, all these things are, should be clean and tidy. You cannot afford to risk this. Okay. So let's talk about, before we put these on, I think it's best to talk about hand washing. Now, hand washing, again, there's a lot of confusion. How to wash your hands, for how many seconds do we wash your hands? Is it actually important to use a soap? So guys, in the exam, I keep telling everyone, this is a clinical exam, yes, but it's a theoretical based clinical exam. Because in the clinic, we do a lot of things very differently, but they're gonna judge us what the book says to do at your clinical life. So they're not going to say what you do in the clinical setting, because everyone works very differently, but theoretical based clinical aspects they want us to see. Okay, what the theory says, that's what they want us to show them, especially in the exam. Are they actually following that protocol, or this is the protocol that they think they've learned in their country, or what they do in the clinics? Because I've worked in a number of different clinics in Australia, and I can say they don't follow proper infection control protocol. If you follow what they tell you, you're going to fail the exam. Trust me on that. Okay. So for washing hands, make sure first 5 to 10 seconds, wet your hands. Wet your hands with water. Take the soap. Do all the 5 movements. Now, again, you need to follow all the 5 WHO movements. If you don't follow, then again, it is a problem. So make sure you follow all the 5 WHO movements, which are basically this. So just Google WHO movements. I want you to follow all of those. So 5 to 10 seconds wet hands, then 10 to 15 seconds with soap, 10 seconds washing, and then 5 seconds drying. So it becomes like a good 40 seconds cycle. Do that properly. Trust me, there would be no problem in infection control with washing hands. And up till here, remember guys, up till here. Never do it here. If you're wearing a gown or if you're wearing a shirt, make sure you lift it up till here, and then wash your hands up till here, not till here. It's completely wrong. Another thing is, if you want to sanitize, a lot of people sanitize, but they just follow this movement, or they just do this, which is again wrong. The 5 WHO movements actually suggest us how to actually clean our hands properly and how to remove all the bacteria, because a lot of bacteria, they harbor in the areas. And when we do those 5 movements, that's when you actually can, get rid of those bacteria. So at the same time, when we follow washing or alcohol rub, make sure follow all the 5 movements. And yeah, I know that alcohol rub evaporates really quickly, but at the same time, even if 4 seconds, just do it properly. Yeah. Like I'm doing. If you see my hands, again, you need to follow the movements. Okay. Another thing is when to wash hands and when to do sanitize. Let's talk about that a bit on a later stage. So for your exam, you just need to worry about 3 things. Yeah. Glasses, mask, gloves. Again, another thing, most important, crucial thing, keep it simple. Do not stress yourself and, just complicate your life. You're already very stressed for exam. Just keep it simple. Don't listen to 20 different mindsets. Just listen to 2 people, follow that, and it'd be a lot more easier for you to perform in the exam. Okay? So how to put on, what is the sequence to put on the PPE? Gown always goes first, which you'll be wearing the gown from the start, so you don't have to worry about that anymore. Okay? Second thing is mask goes second. Glasses goes third, and then gloves goes in the last. Okay. And when we remove them, you go completely opposite. So gloves go off first, then you do the glasses, then you do the mask, and then last you do the apron. But again, in your exam, you don't need to worry about the apron. Over here, this is an American board presentation here. This is from the American Dental Board. So you don't worry about that. In Australia, gown always goes last and mask is second last. Okay, so don't listen to what this says here. Just focus on what I'm telling you. Okay, so gloves opposite to this. So first thing is apron, which you already be wearing the gown, then mask, then glasses, and then gloves. And when you remove it, do completely opposite. Yeah, this is again the same thing. Now let's talk about when to wash hands, when to sanitize. Again, as I said last time as well, as I said last time as well, not so yeah, washing hands whenever you leave the room and whenever you enter the room, you wash your hands. Normally it's like whenever you leave your station, but with the new format, they've changed it. They've made your life easier. So whenever you leave the room, both in technical, clinical, it remains the same. Whenever you enter the room and whenever you leave the room, you wash your hands. And while you're inside the room, once you enter, you wash your hands in the start. In the middle of that 10 minutes for your clinical task, or in the middle of the 6 hours for your technical task, you just alcohol rub. You don't need to wash your hands again and again. And when you want to leave the room, before you leave, you again wash your hands. So entering the room, leaving the room, keep it simple, you wash your hands. In the middle, just alcohol rub. Okay, let's talk about clinical day first, because that's a bit more tricky for a lot of people. So now the basic question I get is, okay, I wear side shields. And should I wear it or should I remove it when going to the communication? Because you have communication OSCEs and then you have skilled OSCEs, right? So for the communication OSCEs, you have to understand that concept that glasses are considered clean. Okay? Your glasses are considered as clean. So when you put side shields on them, now your side shields are a part of your glasses armamentarium. So now they're a part of your glasses basically. So if your glasses have side shields, now they're a part of them. So if you want to go to communication task and you're wearing the side shields, that's completely okay. I did the same as well. Okay, you don't need to remove your side shields or wear them and remove them again and again. You don't have to do that. Just wear your side shields. Now consider them as a part of your glasses assembly and your whole glasses basically. So just treat them as your glasses. They're not very separate entity or anything. Okay, so when you go to the communication task, you don't have to remove your side shields. Wear them. You don't have to do anything. Let's talk about clinical skilled OSCEs. Okay, this is tricky, which is not tricky, but let's solve that, make it simple. When you enter the room, you have 3 minutes to read the task. Okay, in that 3 minutes, you cannot do anything. You cannot even wash your hands. Just read what the scenario says. Try to understand. In those 3 minutes, you can go and basically, you can look around as well, the things as well, which there's no point of discussing. But those 3 minutes, you don't do anything. As soon as the bell rings and you have to start, first thing you wash your hands. Again, as I said previously, 45 seconds, spend a good time in that. Wash your hands. You're already wearing your gown. Go to the area, the clean area, pick up what you have to pick. Okay, drop it in the trolley or the tray at the dental chair side. Once you've done everything, alcohol rub, wear a mask, wear glasses, and then wear gloves, and then start doing whatever you want to do. Okay, so let's do it again. You wash your hands. Then you can go straight to the clean area, pick up whatever you want to pick. With clean hands, it's all good because you've already washed your hands. Drop whatever you want to. It's a rubber dam or official seal or, for example, a matrix band, whatever you have to do, or LA, you need to assemble that cartridge. Assemble that at the clean area. Bring all that, whatever you have to use for your patient. Drop it at the trolley or the tray. And then go again, alcohol rub, wear your mask, wear your glasses, wear your gloves, and then start doing whatever you have to do. Okay? When you finish, like your skilled OSCE is done, you've done everything. Now what you need to do is you remove your gloves. Yeah. You take off your glasses. Okay? You take off your glasses. And then you wipe them. Wipe them. There's no alcohol wipe present, but that's okay. You pretend in the exam to tell the examiner that you know. Okay? Take off your glasses, wipe them with a tissue. Go and drop it in the clean area, in the trolley. Drop them in the trolley. Come back. Remove your mask. And whenever you remove your mask, just always just touch this side. You just have to touch this. Never touch this. it's again an infection control violation. Always touch this and remove your mask. Wash your hands properly. Wash your hands properly. Once you've washed your hands, pick up your glasses and then leave the room. That's all you need to do. Okay, so once you're finished, you remove your gloves. You can alcohol rub if you want to. Remove your gloves, alcohol rub, take off your glasses, wipe them with a tissue, considering like you're showing them you're alcohol rubbing that with the alcohol wipe. Drop them in a clean area in the trolley. Remove your mask just from the side here, from the loop. Wash your hands properly. At this stage, normally we remove the gown, but because in this exam, they don't want you to remove the gown, so don't need to worry about that. Just worry about 3 things, okay? Once you wash your hands, pick up your glasses, leave the room. That's all you need to do. So skill DOSKI is done, okay? Communication is also done because in this one, we don't have to do anything. The only concern is, should I wear the side shield or not? Yes, you can. There's no problem in that because it's a part of your glass assembly now if you put the side shield on. Okay, let's talk about technical. Technical, it's 6 hours. Again, you enter, you're already wearing the gown. Don't need to worry about that. When you enter, you wash your hands properly. Again, follow the 5 WHO movements. In the second stage, you put the mask on, then you put the glasses on, and then, wear your gloves, follow this protocol. In the middle, if you want to remove anything, for example, that you need more stuff, you can remove your gloves, alcohol rub, go and get it from the main area there. For example, if you want to pick up something, or you feel that, your glasses are again, like fogging, or you have to touch your glasses, you remove your gloves, alcohol rub, touch your glasses, adjust the loop light, and then alcohol rub again, wear your gloves. So whenever you remove your gloves, you alcohol rub. Please do that. Whenever you remove your gloves, I just need to open the light here because I cannot see. Hope there's not much shade. Yeah, it's a lot better. Okay, so whenever you remove your gloves, you alcohol rub. Before wearing your gloves, you alcohol rub. If you do that, there's no harm in doing that, and you're completely safe. Okay? Most importantly, whenever you remove your gloves, straight away alcohol rub. In this exam, if you want to adjust, I'm talking about the dental chair light. If you want to adjust the dental chair light, if you want to adjust, for example, the head of the mannequin, you can do it with your gloves on. You don't have to, remove your gloves. The only thing is, please do not keep touching your gown or the dental, like the chair, the dentist chair, or your pants or your trousers, which are not considered clean. You cannot do that with your gloves. Okay? Secondly, if you want to change your loop light, because I wear loops, and if the light is not good, or if you're fogging off your glasses, again, as I said previously, are considered clean. So you cannot go with your gloves. You have to remove your gloves, alcohol rub, do whatever setting you need to do in your glasses. If you want to adjust your light, do that. And then you again wear new gloves. Whether you have to touch your glasses 20 times or 200 times, you will follow this procedure again and again because glasses are considered clean. Okay? Another question, let me actually open the Facebook page because I need to check what comments people gave because I promised everyone that I will go through all the comments as well, so it's gonna make my life easy as well. Let's go through there. Why the internet is so slow? Come on. Okay. Yeah, it's taking a while. Yes, go. Go. I really appreciate people who have given the review. Yeah, thank you so much. I had a couple of messages recently from a couple of people about the putty video. And yeah, I was like, thank you so much. I appreciate that. The main aim of this group is basically to help people. It's not just to give them the best, guidance, or to give an honest opinion. That's what the main of this group is, or the videos that I'll post will be. So it's not just about taking people's side and stuff. It's just about telling the right thing, in my opinion, what are correct. So, yeah, okay. Why is it not working? Do you think it'd be possible to do a little video from entering technical day and lunch break, skipping task, PPE procedure for disinfecting sharps, keep it tray, infection control, skis version? Yeah, I think I've already explained all this for the skilled OSCE, so it shouldn't be a problem. I'm sorry, it's really hard for me to do a video because I need a videographer otherwise to record me, because I cannot do with one hand and do this. So I'm sorry, it would be hard for me to do. Would be great to know how to take care of your prescription glasses and the basic infection control protocol. As I said, that if you're wearing prescription glasses, just put the side shields on. It should be completely okay to do it in communication task. When you go to the skilled OSCEs, just make sure you wear them after mask. And then, you don't touch them. If you have to touch them, make sure you remove your glove, alcohol rub. And then after removing it, as I explained to you previously, that make sure you wipe them and then put it in a clean area, remove your mask, wash your hands, and then pick it up. So it's pretty good. And I have a question in regards to infection control using loops. What are the steps of putting on and off your PPE in loops? So loops, again, guys, it's like glasses. So it's nothing different, right? Loops are, again, glasses. Just treat them as glasses. There's nothing like a very complex thing in loops, okay? Simple as that. The only thing, as I discussed, if you want to touch your light, adjust anything like your glasses, just remove your glove, alcohol rub, do it again. Don't do it with your gloves. That's all you need to do. Another thing in loops is, some people have a wire for their light. That wire cannot hang outside of your gown. If you're wearing that light, and this is again very important, it has to go inside your gown. And then take it out from the bottom of